fantastic group of anesthesiologists, and we're looking forward to sharing our pathways, how we got into the profession. We're going to talk about match and some information and tips. Sorry, I just realized my son got something on my shirt. So there's a little stain here. The joys of being a new father. So we'll wait another probably 30 seconds, and then we'll start with some introductions. Dr. Greer recently matched. I'll let her introduce herself, but she's going to provide, she's going to kick us off with some very relevant, timely information as she just went through the process. And I think we all have a Chicago, well, we have a very strong Chicago connection, which we'll also likely discuss. So we'll wait just another probably 15 seconds, and then we'll jump into it. Dr. Obio, how's your little one?
She's doing great. Hopefully she doesn't show up on screen because she's downstairs today.
The more the merrier.
Hopefully she does. I would love to see her.
After this, Stephen, I'll put on screen.
All right. Fantastic. So we have 41, 42 participants and climbing. There is a chat feature, and we have Dr. Love Anani with Tour for Diversity, who's kind of in the background hosting, and he's going to be able to forward all of your questions over to us so we can get those answered. We have a list of questions that we'll get into that are kind of basic questions that most people have asked at some point or another. So we'll talk about that. And we'll get into it. First, I want to give a disclaimer. Our panelists, thank you so much for being here. They do work at academic institutions. What we discuss here does not reflect on the mission vision departments for which we work. These are our attempts to give back to the community. This is general advice. None of this will directly contribute to your odds of matching to a specific program. This is just here as a benefit. There is no conflict of interest. Dr. Anani did say that you can use the question and answer box as well to submit questions. Fantastic. So that disclaimer is out of the way. And the second thing I want to mention before we jump into introductions is apologies for the lack of representation. The Tour for Diversity also works with the LMSA, and I was unable to, I need to expand my collaboration with our Latin brothers and sisters in medicine. So in the future, hopefully we'll have some more representation in that regard. But thank you for joining us. Again, most of this information is generalizable to everyone who's in medical school and seeking to match into anesthesiology. All right, that out of the way. We're going to start with introductions. We will go in order of ladies first, and we'll start with Dr. Greer with just introductions. Tell us where you're from, kind of where you attended medical school, anything interesting, and we'll just go through some quick introductions.
Hi guys. So yeah, I'm Dr. or you can just call me Majesty. I'm originally from Hawaii. I grew up in Oahu. I went to undergrad at Northern Arizona University, and then I went to medical school over at Howard. And I'm now a PGY1 resident at Stanford for anesthesia, but I'm in my internal medicine year at the moment. But it's kind of nice. We get a little bit of anesthesia time. I'm actually in my 2-week anesthesia block right now. So.
Sure. Dr. Obio.
Good evening, everyone. I am Dr. Obio. I grew up in Texas, the Houston area to be specific. I did undergraduate school at Baylor University, and did medical school at Loyola University in Chicago, residency also at Loyola, and did my obstetric anesthesia fellowship at at Stanford, and now I'm at the University of Chicago as faculty.
Dr. Richards.
Hi, can you hear me? All right. Hey, I'm Dr. Richards. I'm at Moffitt Cancer Center in Tampa. I went to medical school at the University of Florida, went to anesthesia residency at Baylor College of Medicine in Houston. And interesting fact, I love mangoes, as Stephen can attest to.
And Dr. Estime.
Right. Stephen Estime. So I did, let's see, I did my undergrad. I'm from Michigan. So I did my undergrad at the University of Michigan, stayed in the Detroit area. So I went to Wayne State Medical School. And then I came out to U Chicago for my anesthesia residency. I did some time at Brigham and Women's Hospital for my ICU fellowship, and then came back to Chicago and have been there since. Really excited to talk with everybody today.
Fantastic. I'm Dr. Stephen Bradley, graduated from Howard University. That's how I know Dr. Anani and Dr. Greer. Attended University of Chicago for residency and fellowship. Worked with Dr. Estime and Dr. Obio, and I overlapped, and worked with Dr. Richards as well. So that's why we're all here, to give back. In the next couple of minutes, if Dr. Greer, would you mind kind of sharing your experience with the match process last year, how the signaling went for you, how the virtual interview process went?
Yeah, of course. So yeah, with the signaling, I think this is going to be the third year in a row where they kept the 15 signals, to my understanding. So last year I had 5 gold and 10 silver, and basically what I was told with that, like talking to other PDs, is that you'll mainly get interviews within your signals. I did get a couple outside of my signals, but it was only like 2 or 3. But talking to a lot of my co-residents, most of them also kind of got interviews within their signals. There's different ways to kind of go about signaling. Some people like to spread out their 5 gold and their 10 silver to kind of get places that they really want to go to, or places that they think that they have like a better chance of getting an interview at. The way I chose to do mine is my top 15 program. So my 5 gold or my top 5, and then my 10 silver were after that. And of course that can change once you get like, well, your signals can't change, but just know that you're not stuck. Like if you're like, oh yeah, this is like was my gold, you don't have to like rank like that. That's just kind of how you want to get interviews. My mind definitely did change after doing interviews and doing aways. Um, so yeah, that's kind of how I approached it. And then the programs I applied to that I didn't signal, I used the residency navigator, or sorry, Residency Explorer website, and they had data on each program and what percentage they interviewed that gold signaled them, silver signaled them, or didn't signal them. So that way I could increase my chances to places like, for example, like there'd be programs where they would never interview anybody who didn't signal them at all, or places that like only signaled their gold. So I kind of knew how to navigate that. And there were programs where like 14% of them would interview you if you didn't signal them. And so that kind of helped me figure out the best way to apply and not waste my money on places that probably wouldn't give me an interview if I didn't signal them. In total, I applied to 24 anesthesia residency programs. And then I applied to maybe like, I think 15 preliminary programs. That included like TY and internal medicine. I did end up matching categorical. And then another caveat to the signaling, because it gets really confusing, is also your geographical signals. So you get 3 areas that you can geographically signal. And they say that it's better to geographically signal than not to geographically signal based on the data. So what I did was like, I didn't really minded where I went. I just wanted to go to the best residency program for me. So I just picked out my top 15, and then I picked out my geographical signals based on like where a lot of them accumulated, to kind of help me out there. And I did realize the programs that I got interviews with outside of my 5 gold and 10 silver were within my geographical signaling.
Fantastic. Thank you so much for that. And so doctors Estime and or Obio, can you discuss kind of on a higher level the signaling process? I know there's a lot of different opinions on how different institutions look at the signaling. Can you shed any more light on that?
Yeah, I think I'll jump in and take that one. I served as the associate program director for the University of Chicago. I actually just stepped down from that role last month. But I was in that role for about 4 years. And so I got a sort of a good understanding, and I saw how things looked prior to signals. And then as we started initiating signals, because it first started with 5 golds. And then, as Dr. Greer had mentioned, it expanded into 5 golds and 10 silvers, over the past 3 years ago is when they expanded. So I'll give my opinion on this and understand that this is just my opinion. And so not everybody thinks the way that I do about this sort of as a, in program leadership. But, when I give advice on this topic, I think the gold program, so the gold are the most valuable. You only have 5 of them. And so programs understand the value that each of these gold signals have. And so generally speaking, you're going to be most likely to get interviews at your gold signals. And so you really have to think carefully about how you use them. That next tier, the 10 silvers, I think that depending on the programs you signal, there is a chance you'll get an interview depending on how you signal them, but there's going to be less of a chance that you'll get an interview as compared to if you golded them. And then certainly if you don't signal at all, the chance that you get an interview is much less. It's not 0, as Dr. Greer had mentioned, but it's much less than either of the two. I think when thinking about how to strategize using gold, silver, and then no signals, the advice that I generally give is because your gold signals are so valuable, you really want to signal appropriately. And what I mean by appropriately is you want to understand how competitive you are as an applicant and how competitive the program that you're applying to is in relation to your competitiveness. And that's a really, really difficult thing to sort of understand. And I think, perhaps the best way to do this is to try to ask somebody who has seen a lot of applications rather, and is pretty close to that experience. And so if you are fortunate enough to have a home institution that has an anesthesia residency program, I mean, frankly, in my opinion, this is the work that program directors, associate program directors, and assistant program directors at your home institution should be doing. They should be able to talk with their home students to try and advise them on how competitive they are and whether the places that they're gold signaling are appropriate for their level of competitiveness. If you don't have a home institution, that certainly makes it a little more challenging, because then that means you're going to have to try to seek that individual that might have that expertise in sort of assessing how strong you are as an applicant, and it can actually give you a realistic assessment. This is not the time that you're fishing for compliments and you need people to pump you up. You need people to keep it a buck with you. You want to have somebody that can really give you specific sort of red flags, which we'll talk about in a little bit, tell you maybe where your strengths are, where your weaknesses are, etc. And then how strong that program is in relation. There's no guarantees with it. I mean, you can be incredibly strong on paper and apply to a place. They may not provide an interview, but I think you're going to maximize your chances if you find that individual. I'll stop there.
I think you answered that very well, Dr. Estime.
Fantastic. So doctors Obio and Richards, questions for you. How did you, when you were looking at programs, how did you select which programs you applied to and interviewed at?
So when I applied, I feel like it's such a long time ago. Everything is completely different now. But I picked the programs that I actually interviewed for at med school at, primarily, it seemed. I didn't really interview at that many programs. Relatively, I think I 1, 2, 3, 4, 5, 6, 7. I think I interviewed at like 8 programs. And then I primarily wanted to stay in Florida. And then the other places that I went to were Baylor and Houston, because I applied there for medical school. I know that they're pretty open to accepting people from out of state. And there's a really good program in Houston in general. And I interviewed at Mayo, like Maine Mayo and Cleveland Clinic, Maine. And then there's Mayo in Florida and Cleveland Clinic in Florida. And I interviewed at UF and at Miami. And then I just ranked them based off of how I felt. And then I ended up matching at Baylor, and I applied to TY programs as well.
Yeah, similar to Dr. Richards, went through the process before signaling and everything. I think for me, I'm married, and so I knew that my husband and I wanted to stay in the Chicagoland area. So I basically applied to programs that were in the Chicagoland area, and then there had some others that I applied to maybe because I was interested in the area or I was interested in the program specifically. I ended up matching at my home institution, which was Loyola, which worked out perfect for me. Because when I thought about my training, my father is a trauma surgeon, and he told me a long time ago that when you think about your training, you want to get the most broadest and the deepest depth that you possibly can during your training. And so taking that as well as other mentors that I had, if you're going to be an anesthesiologist, I was mentored to go to places that had very high volume, high acuity, and then also some trauma, because that's also part of the practice of anesthesia as well too. So I wanted to find places that had level 1 traumas and was in the Chicagoland area. So that kind of narrows down the programs into the ones in which I applied to. I can't remember the number of programs I applied to in total. I didn't apply to many TY or like internal medicine or general surgery intern. I pretty much applied to pretty much categorical programs because I knew wherever I was going to go, I wanted to be there for 4 years, and that's pretty much where I interviewed and was able to get a categorical spot as for residency as well.
Fantastic. I think if I remember back, I think I applied to all of them. I think I spent a lot of money on applications. And then I had some reach programs, and everything ended up working out. I think one of the themes you just heard, and this correlates with the data, that location is a very big part of how and where people choose their residency programs. It's important to note residency is tough. Being in an area that you have a support network or system, or even just a fun city to explore, that can really go a long ways. Doctors Estime and Greer, what are your feelings on away rotations?
Hey, yeah, so I can talk about that. I really love away rotations. So Howard doesn't have a home anesthesia residency program, so it was really important for me to do aways, I think, because even though I was able to do an anesthesia rotation, it's different doing it at an academic institution, which I really realized when I did my 2 aways. And it really helped me in making my decisions, I think. I think like on paper and kind of looking on things on the website, it was really different coming here, coming to the institutions and seeing the vibes, interacting with everybody, and seeing if I actually liked the area that we were in. I have a longtime partner. We just recently got engaged, actually, so he would actually come out with me. Thank you. For a week to come see the areas as well, since he would be moving, and that was really important for me. So I think it didn't just give the programs an idea about who I am as a worker. It gave me an idea of like who the program is as a whole, and really helped make my decision ultimately. And that's why I ended up choosing to rank Stanford #1.
Yeah, I'll jump onto that. I think, you know, I think that's exactly right. If you don't have a home institution, I think you almost have to do an away rotation. I mean, that's the only option you have if you want to get exposure to anesthesia. So that's, that's kind of a no-brainer from that perspective. I think, one question that oftentimes comes up is, should I do an away rotation to help increase my competitiveness? And I think that really depends on who you are as an applicant. If you're somebody, for example, that perhaps is not as competitive on paper and you want to do an audition rotation, I think if you're somebody who you're pretty confident that you can show up, show out, work hard, not complain, and do all the things that is asked of that program, and you can leave a really good impression, then that can certainly be something that takes somebody who may not get an interview, or may not, probably more realistically would probably be lower on the rank list. And it can certainly boost you up significantly on the rank list. And that was our experience over the years also. I mean, we really valued that away rotation that people had done, to the point where there were several people that we probably wouldn't have ranked that high, but because they came in and they put on a fantastic, job, and they were such hard workers, and really were good. We launched them up on our rank list. And so I think it can be something that can really help you. But it's a double-edged sword, because you could be fantastic on paper, come in, do an away rotation. For whatever reason, you just don't put on your best performance, or perhaps there was some interpersonal things that happened or whatever, and it can backfire. So I think it depends on what you want to do. So from a competitiveness standpoint, double-edged sword. I think if you are unsure, if you're really thinking about a program, particularly an area that you're unfamiliar with, or perhaps a place where you don't have the strongest support system, and you want to do an audition to try to figure out whether this is going to be a good fit for you, then I think it's important from that perspective. I mean, my personal experience was exactly that. I did an away rotation in a place that seemed like it was going to be unbelievable on paper and was in a great location. But when I went there for the month, I realized, like, I don't know anybody here. The culture is not really what I had originally anticipated. And it really helped me solidify the kind of program that I wanted for myself in the future. So it depends on what your goals and objectives are with that away rotation. I think they can certainly be helpful, but they may not always be helpful depending on what you're seeking from it.
Doctors Obio and Richards, first, did either of you do away rotations? And second part of the question, well, we'll segue into that after you answer that first question.
Sure. No, I did not do away rotations. I think both Doctors Estime and Greer put it out pretty well. You have to know yourself and know what you're looking for. I know I wanted to stay in the Chicagoland area, so I kind of, and my home institution I was at academic institution with anesthesiology residency. So I just kind of doubled down on that experience and made sure, more importantly, that I got a good, strong experience of what anesthesia was. And so I did my sub-Is at my home institution, so I didn't have to travel out for an away rotation.
Dr. Richards, did you do any aways?
I didn't do any away rotations. And then I think it's so interesting because everything is so different now. I remember when we actually went to the place. We had like lunch with everybody. You could see like how busy our residents, and anyone actually can make it to lunch. You could to feel the vibes and like actually see the place. So I know that some programs have like second looks or stuff like that, or you can go visit them. Maybe I would look into that as well. And I know that it's like a controversial, but I do think that Reddit and Student Doctor Network can be very helpful in this remark or this realm, because it can give you more of like what people are looking for. And oftentimes people's like interview questions in general or gist or things are on there. So it can help you prepare better and kind of get a feel for programs. And people will tell you if places are more malignant or people are overworked and stuff. Because now I see that you can't really get that as much. And if you can network with anyone who's at there, like any current residents or anything like that, or know anyone who's been there, like you just try to seek that out. That probably would help a lot with seeing if a place is a good match for you. Because programs want people that will match with them, and they don't want people who they think won't do well at a program. I know that they really look for any kind of red flag for that.
Hey, Steve, if I could jump in, right?
Yeah,
Just like
please.
one of the thing about these away rotations, because I think this was a question that that comes up a lot, is I think a lot of people, again, in that spirit of competitiveness, some people will go and do away rotations with the expectation that they don't have to signal that program. And so it helps to like, it's like a way that they can save a signal so that they can use it for another program in addition. That's kind of a risky strategy. And I think guidance from the ABA, which is the American Board of Anesthesiologists, recommends against programs doing that. And so, so basically what the recommendation is that if you're doing an away rotation, most programs or many programs will still expect you to provide a signal. You can sort of have a conversation, and I encourage you to have a conversation if you're doing an away rotation with the program director and ask them point blank, what should I do with the signals? Because I'm really interested in this program. I really like this program. Do I gold? Do I silver? You should have an upfront conversation with that so that there's not, so there's not anything left in the open. Because there's some people that come through ours, for example, because at the University of Chicago, there's University of Chicago, but then we also have Endeavor Health or North Shore, which is an ancillary site, but we oftentimes don't intersect with the students that come with us. And so some students won't signal because they just assume that we know. And unfortunately, with the way that applications work is if you don't signal, then we may not see your application because there's like 1,500 applications. We may not see it if you don't signal. So just have an upfront conversation with the program director or somebody in program leadership about what those expectations are. And that's the same thing that goes along with your home institution. So if you've got a home institution that if you're fortunate enough to have that conversation with the program leadership.
Yeah, that's great advice. Definitely mentorship is key from your home institution. That goes also back to that question about how many programs should you apply to. You should have someone looking over your application and helping you with that. What Dr. Richards mentioned and Dr. Abio in terms of getting information about programs, that answers a question in the chat that discussed finding out if residency programs are family friendly. That meet and greet, a lot of programs have the residency meet and greet that's virtual as well. And usually residents are going to put their emails in the chat at some point and say, hey, reach out if you have any questions. And people usually like copy those emails and then they never find them again and they never reach out. Keep those emails, reach out. If you have questions about what the culture is of a residency program and a resident at that institution has made themselves available to you, then you should feel free to have that open, respectful conversation. Don't assume that, be professional, but feel free to ask those questions. We're going to go down the list and ask kind of what is one thing that you think will significantly improve someone's chance of a successful match, just in general from your experience or from different applicants you've seen. And I'll start with Dr. Greer.
Yeah, I think especially because everything is virtual, getting the interviews, definitely networking. So go to ASA, go to AMEC, go to as many conferences as you can, and just like talk to people because it really, really does help. It gets your foot into the door when they're looking at thousands of applications that they're able to recognize your name. That will really help. But also, don't just meet people and expect them to remember your name just from that one time meeting. I tried to maintain contact with people that I met over the years, and I would, shoot them update emails like once a semester, once a year, usually when big things happen. So it had a point to it. But then also, I think kind of helped keep me in their mind. So
That's great. Dr. Obio?
Yeah, the great comment. I mean, I think Greer put it pretty well about networking is really important. Depending on where you are in your medical school journey, I think, like Dr. Greer did say, if you know early on that you're interested in anesthesiology, you probably have the most chance to be successful because you have years ahead of you to just lay the groundwork, whether it be with networking, whether it be with getting the right opportunities, whether it be with the types of opportunity. I saw a question there about what types of experiences you look for, that you can have a mentor that basically almost shows you the playbook about the different types of experiences that you can look into to get you to be successful into not just matching into anesthesiology, but also having a good understanding of what the field is, where we are now, and what the future challenges could be, so you can have a way to kind of prepare for that. I think for those medical students who are in their third year and fourth year, definitely taking care of what's most important, which is why you went to medical school. So taking care of your academic work and making sure that you are performing at the highest place that you possibly can. And then being a good medical student, doing those things that you have to do when you're in medical school, doing that with excellence. And then lastly, also being connected to who you are and why you're doing what you're doing, and having a very good understanding of your story and your journey, because you're going to have to tell that story many, many times. If you're blessed to get several interviews, you will tell that story many times in one single interview session, and then multiple times as during the interview journey. So knowing your story, knowing why you're doing this, and not necessarily embellishing your story. I think being honest, being authentic, and putting yourself out there a little bit. But when you own that story, people can connect to that, and they can see, either they see themselves in you, or they can see where you are trying to go and see how they can help you along that journey. So that's what I would say about being successful to match into anesthesiology.
That's fantastic. Dr. Richards, what would you say can make somebody really stand out?
I agree with Dr. Obio. Try to make your story and what makes you unique stand out, because you I remember when I did in residency, we would review people's applications, and the more unique someone was, and the more like they could stand out and be like remarkable. Like just try to see how is your story remarkable and how you can um, tell that story. Like she said, that's probably the most important thing, honestly.
And Dr. Estime?
Yeah, I guess I'll say a couple things. First off, let's want to be kind of blunt here. Clinical rotations, they matter. How you do on your steps, they matter. We can't pretend like that doesn't matter. And so, what is it? I don't know. The more honors you get, the better. The higher step 2 scores, the better. Is that all that matters? Absolutely not. Your clinical rotations, your step scores, that's what brings you into the door. That in addition to signaling appropriately. But I mean, part of signaling appropriately is understanding how competitive you are, for which, your scores and your steps are going to be important. If it's all pass fail, unfortunately, what that means is if you're at a medical school where you've got all pass fail for everything, unfortunately, that just puts disproportionate impact on your step 2. And that's the reality. That's not, I don't like that. That's not how I wish it was, but that's the way it is. That's number one. I think, Dr. Obio said it really, really well. I think it's knowing your why, knowing your story. So when you're applying to places, and then when you are subsequently interviewing with a place, I think there's sort of 3 different questions that is sort of the subtext of everything. It's, sort of where have you been, i.e., what have your experiences been? What kind of person have you been? What have you done in the past? Are you somebody that's done a ton of research? Are you community engaged? Are you, looking to serve underserved patients? Like, is that something that you've actually had experience doing in the past? Like, who are you? What brought you into this moment now as an anesthesia applicant looking to secure a career as an anesthesiologist? That's the second question. And then the third question is, why this program? You're sitting here right now, you're either applying or you're talking to somebody at the program. Why is this program the program that's going to get you to where you ultimately want to go? And I think what that implies also is having a really good understanding of what your short-term and long-term sort of outlook is. And it doesn't mean that you have to have your life sort of planned out to a T for the next 15 years. But if you thought about it, do you have a general sense of what you're interested in and where you want to go in the future? Because if what you want to do in the future, which is informed by what you've done in the past, if that matches up really well with the mission of the place that you're interviewing at, it's going to make you a lot more competitive. And those are going to be the kind of things that are going to make up for someone who has a lower step 2 score, or someone who maybe didn't get all the honors on their clinical rotations. I've seen a lot of questions about DOs and international students. I mean, these are things that can make up for those perceived, and not that I agree with it, but it's the reality, right? If you got a DO, or if you're applying from outside of the United States, it does make you a little less competitive. But you can make up for these things by being able to really articulate where you've been, why you're here, and then what your long-term outlook is. And the more specific that is, and the more realistic it is, because you've had a proven track record of it, the more competitive that you're ultimately going to be.
That is absolutely fantastic advice. Thank you, everybody, for sharing. And there is a question we had before about what's a good step 2 score for specialty. I'll defer to, there's plenty of data out there. So it was called charting the outcomes. I don't know if it's still called that, but that should be your best friend. The NRMP publishes a lot of the metrics for people that have matched You need to go through that with a fine-toothed comb and really compare yourself, and that can tell you where you fall in terms of how competitive you are. Another, and I'll speak to my application. I am an average student, like right across the board average. My step one score, we had scores back then, it was average, like 1 or 2 points below average. And then I kind of bombed the step two because I took it during my sick year rotation, even though people told me not to, and I did anyways. But my application told the story that I've held, 5 or 6 different jobs, and I worked construction, and I worked and maintained these decent average grades. So I think my application spoke that Stephen Bradley is a hard worker, and he will work his butt off if you let him into your program. So I think that's what really shined through on my applications with all those essays that you have to write, those little blurbs. It should kind of focus in on a theme. Dr. Estime touched on some of the questions in the chat, a couple comments about DO applicants. Dr. Obio, have you had any experience or seen any differences when working with DO applicants or students? Is there anything that you think they need to do differently to match?
That's a really great question. I think 2 things I would say. First thing is, there is a lot of information, and a lot of the other speakers on this panel spoke about different places you can look at online, whether it be Reddit or Student Doctor Network or other places that look at what people that are actual trainees at these different institutions, what their experiences have been. And there are some programs that are necessarily quote unquote DO friendly. So figuring out what those programs are would be helpful. And if you have a program in mind and you're like, okay, I don't even know where to start, think about the places that you would like to go to their websites and look at their current residents and see, and it will usually say the name of the resident, first name, last name, and then medical degree, whether the designation is an MD or an M or a DO. Or even if they're international, it'll say MBBS or things like that. So that's another place if you're just trying to do a rough, query of information for different programs that you think that you're interested in, that you think you want to go to. You can even look at their current classes, previous classes, to see what has the mix of their current residents look like, and see if you can see your profile or your degree in that mix. That's the first thing I would say. The second thing I would say is also for your home institution, whether your home institution has a anesthesiology residency or not, take your numbers and go speak to your dean of education at your medical school and say, where have the people in our school matched for anesthesiology and what have their metrics looked like? And you can also see for your own school how competitive or how successful have their recent graduates been in matching into anesthesiology. And the ones that have been successful in matching into anesthesiology, you can consider reaching out to them through your alumni network and or reaching out to those programs or even applying to those programs since they have taken graduates from your school at those programs. When it comes to DOs, I was at a residency program that had probably like quite a few DOs. And from my experience, a lot of them did away rotations. This is before the era of signaling. So a lot of them just did away rotations at programs that either people from their DO programs had successfully matched into or had historically matched into successfully. So that's what I've seen for the DO students. I have like, I think 3 or 4 DOs that were in my residency class, graduated together. They were able to get to the fellowships and they were able to get into the jobs that they were looking for afterwards. So there are DOs in anesthesiology. They're not as common, but they're there. And I think doing the work on your end to figuring out where your graduates from your program have successfully matched to anesthesia will be a first place to start to look into that information.
That's fantastic. We're going to go from one Stanford alumnus to a current Stanford resident. Dr. Greer, shameless plug, Dr. Greer and I and a couple other medical students are creating a podcast, the Medical Students Guide to Anesthesia podcast. We discuss a lot of these. We've had Dr. Obio actually is going to be featured on that podcast as well as one of our attendings that I worked with, who's a DO cardiac anesthesiologist. So stay tuned for that. But Dr. Greer, let's talk about research because, research is important. Yes, you can match to anesthesia residency successfully without research, but it really helps set your application apart. And Dr. Greer, who had an amazingly successful match to Stanford, can you share the research that you've done and how you went about getting involved in that research?
Yeah, so I did a lot of research actually. I think more than some of my fellow just like anesthesia cohort, like residents at Stanford as well as residents at other institutions. And I it was because I had a lot of research from undergrad to help me get into medical school. With like my journey, I was a very like average undergrad, so I needed extra things to kind of help me get into medical school. But what's really great is all the numbers still count for your residency application. But I did decide I wanted to do some more anesthesia focused research. So I knew I was interested in anesthesia since I started medical school. I used to be a PACU and pre-op tech, which is how I got exposed to anesthesia. So I was looking for opportunities since the first year of medical school. I actually ended up getting into the REACH program at Stanford. I think it's called Health Equity and Education now, but it's a partnership with the HBCU medical schools to do your research, and then they try their best to match you into your specialty of interest. So it was the summer between my first year and second year of medical school, and I ended up working with an anesthesiologist doing neurology-based research, and that helped a lot. And I was able to actually get involved in a few papers with that, as well as go to some conferences, which was really, really amazing. But then I didn't really do too much research again until my third year because I was more focused on trying to get good grades, really focus on my academic part of it. But I realized I did want a little bit more anesthesia focused research. So I reached out to one of my mentors. Um, and he works over at the Mayo Clinic. And I kind of told him that I had a harder time finding research because I went to a program that doesn't have a home anesthesia residency program. Our anesthesiologists oftentimes don't do research. It's a little bit more difficult to find it. And then I had reached out to other places in the area, like GW in Georgetown. However, it's also limited because priority goes to their medical students, which is totally understandable. So I just reached out to my mentor and kind of told him that I was interested in doing more anesthesia specific research, and if you could help me find somebody that would be willing to do it. And I was looking more for something that was remote, so that way I would be able to do it while I was in my third year rotations. And I ended up doing a social media focused anesthesia research. We actually published a couple papers, which was really cool. It was looking at the quality of information on YouTube surrounding acupuncture for chronic pain and cannabis for chronic pain. And so that was really cool because I really love anything to do with social media. I think it's really important to do more research into it because I think that's how a lot of our patients are getting information, as well as like how we are getting information and we're choosing to make decisions in our life focus around our career. And then it was anesthesia focused. So that was really awesome. But yeah, those are the two main things that I had done. I would say if you're interested in doing research, definitely like just reach out to people. The worst anybody can do is either not reply or say no. But the result's still the same if you didn't reach out. Because there's a lot of different opportunities out there. And if you do reach out to somebody, I would say do your research, read through what they've done and see if you're interested in it and be able to like if you email them be able to speak on that and kind of give what your interests are and how you could see contributing to them, because that's also what's really, really going to help. And the next advice I have to say, it's always like quality over quantity. I did have a lot of numbers because of my experience in undergrad, but I do think my medical school research was more focused in what I was more interested in, which I think made it more exciting for me to talk about it during my interview process. And I think that my interviewers were able to see that I really was sincere and I wasn't just doing the research for the numbers of it, but I actually was interested in the projects that I was doing.
Thank you so much. And I wanted to highlight the longitudinal aspect. Someone in the chat had mentioned reaching out and not hearing anything back because I don't always have a research project going that I need help with. Dr. Greer, I emailed her like 2 or 3 years ago about this podcast project, and that didn't work out. And when I received a grant for it, I went through my email to see who had responded 2 years ago, and her email popped up. And that's how we were able to finally connect and collaborate. Going to conferences, join the ASA. It's cheap for medical students. Join your state society. There's opportunities through the IARS and other research pipelines that are already there to get involved. We're heading into interview season. And let's see, Dr. Obio.
Yes, and that was great. Congratulations. That's amazing. I do want to speak to those who are interested in research and may not be able to find anesthesia related research. A little bit about myself. I did my research in urology or urologic oncology. And so some institutions have very productive research people that are not necessarily in anesthesiology, and that's totally okay. Anesthesia research is a very difficult thing to find, and it's like finding a needle in a haystack. So finding somebody who either has the clinical time and the funding to do it can be very challenging, but there might be a physician in a different specialty who's quite productive and has opportunities for you to get involved in that research. And so if you're willing to think outside the box, you can find an opportunity for research, even if it's not necessarily anesthesia related, but it can give you the longitudinal, it can give you the quality, it can give you the ability to just show that you do have a mind that is curious, looking for trying to solve clinical questions. And there are many clinical questions in anesthesiology that you just need a really good question and a really good team to support you to get that research off the ground. So don't be discouraged if you can't find research in anesthesia. There are many specialties that have research going on. If you can get involved in that, that will count as well too.
Absolutely. When you join those state anesthesia societies, they oftentimes have a state conference as well. There's posters that can be presented. So, maybe you don't find the right research, but maybe you find the right mentor or person that can direct you to that research project.
Hey, Steve, if I may jump in as
Yep,
well
please go.
too. But I think that there's also this conception that you've got to do research, and it's kind of like this checkbox to check it off so that you can actually get into a place. Understand that each program values research differently. And so I think as Dr. Greer has demonstrated, she's had an interest and has done a lot of research in her career, hence she matched into a very research-focused residency. When I think about the research-heavy residencies, really Stanford and MGH and Brigham are probably the three that come to mind. And so if you're going to apply to those programs, you better have a pretty good research portfolio. But understand that that's not most programs. And so other programs are going to be focused, and they may be looking for another skill set, particularly programs that perhaps are more clinically based, perhaps are more community based, perhaps are more rural based. They may be looking for different experiences. Understand also that research isn't all just, like pipettes, beakers, and, statistics. You can convert a lot of the stuff that you're doing into academic work. So if you're somebody who is really community focused, health equity, and maybe you've done a lot of volunteering, or you've done a lot of leadership, or maybe you've had a whole previous career, whatever that is, you can convert a lot of these things to academic type things, whether that's doing a podcast, whether that is writing an op-ed, whether that is presenting something interesting at a conference, and doing that. So, understand that there's a lot of different ways that you can take the interests that are authentically you and convert those into things that count for academia.
Just wanted to really briefly also say kind of on that, because you had reminded me, one of my most favorite posters I did actually was I was president of our school's AIG, and I had done I helped organize a meet and greet. It was with Stanford. But I worked with Dr. Perez, and he told me that, like, oh, during this meet and greet, you could actually turn it into a poster, which was a really great opportunity. We actually took a medical student from each year who was interested in anesthesia, and we just sent out a survey to everybody who attended the meet and greet, and just kind of like what their interest was in anesthesia before it, what their interest was in the anesthesia after, and then what their interest was in the specific program. And then we were actually able to make that into a poster to present at ASA. So yeah, you definitely can turn anything into research. It really doesn't have to just be, your basic science labs, or even case studies. You can do something like at your school, and go ahead and do surveys. So
I love the organic conversation, because if we're honest, research gives a lot of people anxiety and heartburn, especially as you're trying to apply and match in anesthesia. And I think that we saw this with all the questions and comments and concerns about research. So hopefully those excellent replies hopefully put your mind at ease. and or gave you some different areas to focus on and how you can adjust your application. As we're heading into interview season, I'd love to go through and get a tip or two for successfully interviewing virtually, which only mostly one of us has done, but a lot of us have participated on the other side of these virtual interviews. So, Dr. Richards, what would you recommend tips for a successful interview?
I think you should practice, 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 and practice with professionals. I'm sure Dr. Estime would say, like, get your program director, or even if they're not in anesthesia, you can practice with a program director and interview with them at your school.
Dr. Obio?
I agree with Dr. Richards. Practice is really, really important, and especially in this virtual age that we live in. Practice not just with the interview, but also practice for yourself, learning your own cadence, learning what the lighting that looks favorable for you, and all the things you got to do to just make sure your setup is something that you are proud of. So practice is important. And I think the second thing I will say with your interviews is right before your interviews, not necessarily the day before, but before your interview date, refresh yourself with your actual application. The worst thing is when you're going through an interview and you're talking to an applicant about their application and they have forgotten what they wrote or they say something incorrectly. So just for your own self, refresh yourself with your application and sometimes put a little bit of thought into what you're going to say in response to anything, and understand that anything that you have on your application is fair game, so be prepared to answer them.
Dr. Greer?
My number one tip besides doing mock interviews is definitely being yourself. I think that's the most important. Being in a virtual format can be very uncomfortable for everybody, but if you're able just to bring yourself like, or sorry, if you're able to just be yourself and kind of have a natural conversation, it really will make the process a lot easier and pretty fun. I really enjoyed all of my interviews, and we talked a lot about stories here. And I had a story with my application, everything that I did, and I really made sure to like not only show who I am as a person, but bring everything back to my general story of the type of anesthesiologist I want to be, as well as like what's important to me. And yeah, so yeah, that's my big thing is just be yourself, have fun. This is a chance for you to get to know the program. So that way you can also choose what's the best place for you.
Fantastic. And Dr. Estime, I'm sure you've done a virtual interview or two in your time as a associate PD.
One or two. So let me tell you something. I mean, the basic stuff, and I think Dr. Obio not only said it, no offense, she's probably demonstrating it the best right now. And that is, make sure that you got good lighting, make sure that you got your angle good, make sure that you don't have a bunch of background noise or a bunch of background distractions, or it's not your time to have like people in the background. I mean, like what is there? And this is not what I'm in a back bedroom with no lights on, as you can tell. That's not what I want to demonstrate, but that's what I am demonstrating if I'm interviewing with somebody. So make sure that you have your background, your appearance, professional, and it's what you want to express, whether that's your own unique way. I mean, that's what you want to express. So that's a reflection of who you are. Make sure your mic works. And so the only way that you can tell that stuff is, as Dr. Richard said, practice. It could even doesn't have to be a program director. I mean, do these virtual things with your friends. You can do it with other friends and just go through articulating. So that's one part. But practice going through articulating your why. What are you doing? What are you bringing? Articulating that and being able to articulate that in a succinct way. And then number three, make sure that when you're on your interview, while you may know your why, make sure that the program knows your why and how your why connects to their why. Their mission, their vision, their values, whatever that is. How does your why connect to their why? Don't make them do that leap for you. Express that. And honestly, this is sort of a game when you're interviewing, that sometimes they're going to ask you a question but you in some ways want to answer the question in a way that you're still advancing the information that you want to have set forth. And so you want to be able to answer that question in a way that connects it back to what your why is and why your why connects to what their why is.
Absolutely phenomenal answers. And we are getting short on time and absolutely want to be respectful of everyone's time in the last 4 to 5 minutes. First, a quick question for Dr. Estime. And then I'd love to end with a round robin where everyone provides a piece of advice or encouragement to the 48 folks we have still with us. So quickly, Dr. Estime, with your experience as a program director, how do you feel? What's the general consensus on emails to program directors and or faculty, whether it's thank you for the interview or updates? What's that communication look like on your side?
It's a really good question because there's not a right answer for it. I think maybe a right answer is send thank yous after you finish interviewing. I don't think it ever hurts to send a thank you. Now, in terms of communicating before the interview process, during the interview process, after, I think a simple thank you. I think the problem is it really depends. I'll be honest with you. For me, I don't mind some of the communication. For other program directors that I'm around, it bothers them. So it's really, really difficult to tell. I can't give you a one-size-fits-all answer. Try to be respectful. Try not to be too invasive. Try to understand what some of the match rules are and try not to ask questions that would be violating potential rules, such as these visits, these sort of like off-cycle visits to investigate and meet people. I mean, there can be some real match violations with that. Yeah, so I'll leave it at that.
Fantastic. It depends. So we will go through, so we'll start with Dr. Greer, then Dr. Richards, and Dr. Obio, and then Dr. Estime with regards to advice or encouragement. Thank you so much for participating in the panel. I've been throwing the folks off for those of you that are listening because I type in like I'm going to ask this person this next, and then I completely forget what I wrote. So I've been jumping around, and they have been keeping up with me. So thank you all for your participation. Dr. Greer, what's a piece of advice or encouragement you would provide to these students preparing for match?
Yeah, so my number one thing is to take notes, whether it's I kind of jot down a few things during it, not too much, but definitely like afterwards. I kind of did a reflection. My number one thing I actually put in is the vibes of the program, and kind of like the vibes that I got with the conversations. It's really important for you, because remember, the entire rank list is supposed to, the idea of it's supposed to be in the advantage and the benefit of the applicant. You're supposed to rank places that you actually see yourself at. So it is really, really important that you feel like you could belong there, that you get along with the people, that you enjoy the culture of the program, because you're going to be there for 3 to 4 years, whether you end up being a categorical or an advanced resident. So definitely, I would write down the vibes that I got from it after every interview. And then when I came to my rank list, I went and I kind of reviewed that because after doing a ton of interviews, things start to kind of get muddled. So just knowing what your initial um not reaction, but your initial impression of the program was after you finish your interview day can be really, really helpful for you when you are putting together your rank list.
Fantastic. Fantastic advice. Dr. Richards, what's your piece of advice or encouragement?
Two things. One is that there is like at the end of the tunnel. I look at all my friends from acquaintances from undergrad, like some people that like were pre-med, whatever didn't work out, then they went back, then they became pre-med, did medical school and everything. So everyone ends up where they want to be if they keep working on it. So you should keep working on it, even if it seems like it may be difficult, just stick with it and it will all work out. And then the other thing is in general for all people who match, I remember that they want your specific important dates that you want off or whatever really early. So if you have something that you want that's special or a date, like think about it early so you can submit it sooner because usually it's like a first come, first serve kind of a thing. So that's my advice.
It's great advice, taking it all the way back. Dr. Obio.
Yeah, great advice. I'm just going to kind of take a different focus. Remember that training is short, but life is long. And when you're making your decisions about where you're thinking about going to for residency, for training, yes, what you're looking for is very, very important. The program, the vibes, as Dr. Greer described it, is important. But remember that you're also carrying a community of individuals with you. And so if you're take that into consideration so that the people that are walking with you in this journey as you go through to become a physician, you would hopefully want many of them to still be there when you're crossing the finish line and you have your degree and you're finished with your training. So think about who you would like to be around you at that time and how, when you're making decisions, keep that into consideration just so that, you know, when you're done with all of this, you can still look around and the people that love you and that you love are there with you too.
Excellent advice. And Dr. Estime.
I think that's great, Dr. Beal. You know, I think I've talked a lot. I think we've talked a lot about knowing your why. The hard part though is very few people know their why. And so especially in your shoes as a medical student. And so I actually think during the application process, it's a really important time to develop your why. You know, this is a time for you to sit back, think about the experiences that were most meaningful for you. Why were they most meaningful for you? And really, really sit down and think about what does your 2 to 5 year plan look like? And then what's your 5 to 10 year plan look like? I mean, very few people actually know that. So don't be worried if you don't know that, but take time to really think about that and think about what your value system is. What's most important to you? Is that prestige? Is that family? Is that friends? Is that, you know, what is it that you want to do? Because the better that you can develop your why, I think the better positioned you're going to be to make the difficult choices that are going to happen all interview season.
Man, couldn't have said it better myself. Thank you all for this last hour that you've spent with our panelist. I have to shout out the Medical Students Guide to Anesthesia podcast. Stay tuned. It should be coming out in the next month is whenever I finish doing the editing. But special thanks to the many people that have been a part of that. Shout out to Tour for Diversity in Medicine. They are the sponsors that host this crucial event every year, as well as the Latino Medical Student Association. In the background, we have Dr. Love Anani, my forever HUCM student body president. And finally, thank you. Oh, there is a survey for all of you, the 44 remaining participants. Please take this survey to help them continue on the work that they do. And finally, thank you, Dr. Estime, Dr. Greer, Dr. Obio, Dr. Richards. Could not have done this without you. Thank you so much for taking a significant portion of your evening to help us and impart your words of wisdom.
Thank you. This was a lot of fun.
Thank you.
All right. Thank you all. Fill out that survey and have a good evening.